evening and welcome to the Thai PBS World. The issue of cannabis is being widely discussed in Thailand. Last year, the use of marijuana for medical research is allowed to do more research in Thailand. And on a global scale, Canada and Uruguay are the two countries which have legalized the use of cannabis and especially the possession and its byproducts. Cannabis in Canada is legal for both recreational and medical use. It was banned from 1923 until regulated of its use became legal in 2001. Firstly, the regulated use began for medical purpose issued by Health Canada. Various steps of legalization of cannabis are taken in Canada, from frequent uses by a certain number of population to public opinion polls, and then active revision of the laws after Prime Minister Justin Trudeau was elected in 2015. Why the issues are being discussed in Thailand on research and medical use of cannabis. Chief Corporate Officer of a Canadian firm, which is one of the world's largest producer of cannabis, shared the view on experience of the country and its path to legalization.
Canada really was the first country in the world to create a very strongly and properly regulated national medical cannabis system. And it's been very successful to the point where government officials from around the world have been coming to Canada to learn from our public servants and our policymakers as to what made that work so well. But in Thailand, this country is really at the forefront of Asia. And the interest in creating medical cannabis systems, properly regulated systems that will allow patients to access safe products, safe cannabis products, whether it be dried flower or more sophisticated things such as oils or capsules and so on.
Canada is at the forefront in terms of legalizing the use of cannabis. But what's the experience that the country has to been through, especially from the initial stage, that people may have doubt, may have lots of questions regarding its use and whether it will lead to drug addiction? What have you been through?
Canada's experience has been very instructive, and to that I would add the experience of the U.S. states in the United States that have legalized cannabis for consumer use. Before we legalized cannabis for adults to use, adults over the drinking age, basically the same as beer, wine, or liquor, some people had fears that there would be an increase in impaired driving, or that there would be an increase in underage youth use, or that there would be an increase in drug dependence. And none of these things have happened. This has been studied quite well in the United States. And in fact, there have been some positive benefits. There are studies that show in the United States, the states that have legalized cannabis for consumer use and for medical use, that the use of opioid drugs, highly addictive opioid drugs, has come down. At Aurora, we have a very extensive clinical program, clinical studies, and one of the studies that we are undertaking right now actually suggests that patients who use medical cannabis have fewer doctor office visits. So there can be some positives from this, and we have not seen the negatives develop. And I think a big part of that, and one of the most important things to remember when we talk about the potential at some point of legalizing cannabis for consumer use, is that it is so widely used already. And what we're really doing, and the main policy objective of Canada's government in legalizing cannabis, was to migrate or move the consumers over from the black market, the illegal market, into the legal, regulated, and safer market.
The stages that you have been through, does it start from medical use of marijuana, of cannabis in Canada first, before you legalize for adult use?
I'll tell you the way I see it. First of all, we come into this discussion with a great deal of humility. We do not try and push other countries in the world to legalize cannabis for consumer use. We believe that the right thing to do is certainly to create a medical cannabis system to help patients who are not able to benefit from traditional prescription pharmaceuticals. Perhaps those traditional pharmaceuticals aren't working for some patients. In some cases, they can't tolerate the side effects. So we certainly believe in the creation of medical cannabis systems. But what we do not push is the conversation with respect to consumer legalization. We believe that that conversation happens in countries on an organic basis. But we also do think that once countries have an experience with a well-regulated, safe medical cannabis system, it takes some of the fear and the stigma and the worry away and makes it easier to talk about the possibility of consumer legalization.
Can you tell me on the statistics, what's the age range of Canadians who are now relying or using cannabis on a daily basis?
I certainly can. It's really quite interesting. We've, in a very short period of time, in 5 years, we've gone from virtually no patients with a prescription and no physicians writing prescriptions for medical cannabis to a situation 5 years later where now there are more than 20,000 physicians who've written a prescription for medical cannabis for their patients and more than 400,000 Canadians who have a prescription from their doctor for medical cannabis, and that's more than 1% of the population of Canada. In terms of who uses medical cannabis, it's really quite surprising. When it comes to the primary non-intoxicating substance in cannabis, CBD or cannabidiol, some of the patients are little children who are using it for the management of otherwise untreatable epilepsy to stop their seizures. And it ranges, of course, now into seniors, people over 65, who are increasingly using medical cannabis to manage things like arthritis pain or chronic back pain, things like that. So the acceptance is very common in Canada. It's fair to say that medical cannabis in Canada has become quite mainstream, very, very normal.
Listening from your story, it means public policy has to be highly functional and plus well-regulated policy to regulate the use of cannabis or marijuana, which is the topic of concern in Thailand, which is very much debated at the moment. What's the lesson learned that do you like to tell Thai society?
I really would like to share this. It is our belief at Aurora that strong regulation is important to protect patients in a medical cannabis system. And we can see that Canada's system, our national medical cannabis system, for example, is more tightly regulated than nearly all the US states that have legal medical cannabis. We believe that has protected patients very well. Health Canada insists that there be no banned pesticides used on the cannabis while it's growing, so that there will be no dangerous residues left over when these cannabis products are provided to patients. Health Canada also undertakes inspections on a very regular basis of all cannabis production facilities. And these are surprise inspections without warning. So a Health Canada inspector can show up at any of our facilities in Canada or any other producers, cannabis producers' facilities, knock on the door and say, I am coming in. And they can check those things out. And if companies do not abide by those regulations, and we have seen this happen, including recently, they can be shut down. The consequences are serious. And as
that means all companies in Canada which produce cannabis have to work very closely with Health Canada in order to comply with strong regulation of its use. Meanwhile, the United Nations Office of Drugs and Crime, UNODC, released its 2019 World Drug Report calling for public health-based drug policies. Thailand is the first country in Southeast Asia to legalize medical use, but the issues are still being discussed, especially on the bills to allow Thais to grow up to 6 marijuana plants at home, which is the most recent development about cannabis issue in Thailand. And that's all from Thai PBS World tonight.